guys, it's Charity from ALoopandAHook, and today I wanted to do a Q&A on pre-nursing school and EMS. As some of you guys might know, I am interested in becoming a nurse, and I am planning on going to school next year. And I am also involved in a EMS Explorer program with my local EMS agency. I have a few questions that you guys have asked me about those things, so I am going to go ahead and answer them for you today. The first question today is, have I applied yet for nursing school? And the answer is no, I haven't. I am working on applying for nursing school right now. I'm working on my essay. I have almost everything else done, and so I just have to finish up my essay and then submit that and then give the forms to my references and everything, and then I should be good. I'm working on that. I should have it done in the next few weeks, or well, I need to have it done in the next few weeks. I'm going to try to get that in sooner rather than later. So the next question is, what area of nursing am I most interested in getting into? The answer to that is I would like to get into either a geriatric ward or a pediatric ward, or maybe possibly a birthing ward, because I seem to bond really well with the older people and then the pediatrics, so the younger people, and I really like pregnancy and babies and moms and stuff like that. When I graduate from nursing school, that's where I'm going to probably try to get into. And if I don't get into there, I would probably do the emergency room, because that is exciting, it's interesting, you don't know what you're getting. If I couldn't get into any of the other wards, I'd try to get into there. The next question is, what made me decide nursing was right for me? I really didn't want to go to college or do much of anything before I joined the emergency squad. I just didn't want to do that. And after joining the emergency squad, I decided that after seeing the people and working with people who were in need, I decided that nursing was probably going to be the right career for me to pursue, because I just enjoy helping people. I like giving to people. It's just the way I was born. It's the way I am. And nursing, you are able to give to people, you're able to help people, you're there to support them, and I like the support process a lot in the EMS field, and helping somebody and supporting them when they're going through a rough time, that really means a lot to me, and I enjoy that a lot. So I would say that that is probably the reason why I decided that nursing was what I wanted to pursue. Some of you guys might know that I have a goal to pay for nursing school without going into debt. And the question is, how far am I away from that goal? And I'm pretty far away from that goal. I have a lot of money left to make and earn, and trying to make the money and have it set aside so I don't have to get out a loan or anything and pay for it all up front. I'm just trying to get the money together, and I'm getting there, but I still have a ways to go before I can hit that goal. This question is in reference to my EMS Explorer program, and the question is, am I the only young person doing this? So the young person means from 14 to 18, and the answer is no, I'm not. I have about 6 or 7 other people who do this with me. We don't ride on the same shift together because we can only have one Explorer on at the same time for safety purposes and learning purposes. I take one day of the week, and there's other days who have 2 people riding on the same day, and then there's some days we don't have anyone right now. So I'm not the only young person doing this. There are other young people doing this. I am really happy that there's more people to the program, because when I joined about 2 years ago, there were only like 3 or 4 actively doing it. So the program is growing, and the people in charge of the program are trying to get it to grow more so that we can get more young people in and possibly get more volunteers when they turn 18 and are able to become a full member. Our squad is mostly volunteer drivers and EMTs, but we pay out most of the medic slots. This program is mostly to help young people figure out if they want to enter the medical field, and if not, then they can stop the program at any time, and then they know that they don't want to go into the medical field. It's a learning experience for the young people in our community. The next question is, what training did I have to do to become a junior explorer at my emergency squad? And the answer is I had to take CPR. I had to get my CPR card, and that's all I had to do. But this is not a hands-on thing. It's more of us young people sit back and watch what the other medical providers are doing for the patient. And so we just watch, help where we can, which is limited. We just try to learn through watching. My primary job on my crew that I ride with is I'm the note taker. So I take the notes, I write down their blood pressure, their pulse, their O2 saturation, and what time that happens. Anytime that the medic pushes medication, I write that down. I also get their medications, their past medical history, any allergies they have to medications, and then where they live, their name, and all that good stuff. So that is my primary role. I also am the one who is normally the runner from the ambulance to the house. I do get to talk to the patient and interact with the patient. And then I ride with some people who like to have me, they like to teach me different things that I can't do yet, but I will be able to do when I get older and get my EMT license. I hope that has answered your questions about pre-nursing school and EMS. If you have any more questions about this topic, drop them below and I will try to answer them in a further Q&A video. So I'll talk to you later, guys. Bye!